Hi there and welcome. I am so sorry that I'm not able to be live today, but I do have an awesome video to share with you. I have tons of information, so you can watch this video anytime. You can fast forward it, you can rewind it. And of course, after you've watched this video, if you still have any questions or concerns, please reach out to me. I'm available to answer whatever questions you might have. So before we get into the information, I want to share just a little bit about who I am and what got me started in post-surgical massage. So my name is Kristina Gonzalez, and I have been a massage therapist for 11 years. I typically specialize in therapeutic massage, deep tissue, hot stones, cupping, that sort of thing. And recently, in the last 2 years, I started to get more into manual lymphatic drainage, and now I am fully immersed in post-surgical lymphatic drainage. So I have received 2 certifications in manual lymphatic drainage, including post-op lymphatic drainage. I'm also certified in Brazilian lymphatic drainage. But one of the reasons why I decided to get into manual lymphatic drainage is because once I started to learn about it, I realized that there's so much good that it can do for people. Manual lymphatic drainage can help with issues stemming from autoimmune disease, Lyme disease, fibromyalgia. If you're having issues with lymphedema, edema, especially, in the extremities, if you've had mastectomies or if you've had breast cancer tumors removed and lymph nodes removed, sometimes you might experience edema in the arm. So I started to learn what lymphatic drainage is and what our lymphatic system is, because I don't even think we learned that in school. But once I started to learn all these things about this amazing technique, I just started to go in more and more into it, started seeing clients, started helping people using manual lymphatic drainage, and which is what led me to post-surgical, and seeing that I can help people recover after plastic surgery, which is can be a traumatic thing. It just made me fall in love with lymphatic drainage that much more. All right, so now that we got all the intro on all the stuff about me out of the way, let's get to the meat and potatoes about why we're here, so you can learn more about post-surgical lymphatic drainage and manual lymphatic drainage in general, because I'm going to be talking about a lot of stuff today, so get ready. So what exactly is the lymphatic system? The lymphatic system consists of vessels and organs throughout your body. The vessels sit just below the skin surface, and you have internal organs that also help your lymphatic system function. We also have our lymph nodes in our armpits, we have in our neck area, in our inguinal area, as well as deeper lymph nodes that sit inside the belly area and inside the chest cavity. So all of our lymph vessels and organs work to keep our lymphatic system running at its optimum best. So what exactly does the lymphatic system do? The lymphatic system helps absorb fluid from the tissue in your body, and it helps to flush all of that extra fluid out of the body through your urinary system. So essentially, you pee it out. So how exactly is lymphatic drainage massage performed? It is manually done with your hands. That's why it's called manual lymphatic drainage. We use only our hands, no tools, and no machine. How exactly is manual lymphatic drainage massage performed? I get a lot of questions from my clients where they're just not sure what exactly does a lymphatic drainage massage, what is it? Everybody knows what a Swedish is, what deep tissue is, but lymphatic is a little bit confusing. We know that lymphatic drainage or manual lymphatic drainage is not necessarily a massage, but we consider it kind of under the umbrella of massage. What exactly it is Since your lymph vessels sit right below the skin surface, we take our hands and we just gently pull that skin and move that skin so that way the lymph vessels that are sitting right below our skin can open and allow for the fluid to pass through. Our lymph vessels have a valve that only open one way. It doesn't open the other way. So we have to manually, with our hands, pull that skin to release the vessels to allow them to open up. And that's exactly what lymphatic drainage is. So you're probably wondering, okay, I kind of understand what lymphatic drainage is, but why do I need to get a lymphatic drainage massage done? I have a lymph system and it should be working on its own. Well, just like anything in the body, things sometimes do not work as they should due to environmental issues, health issues, diet. It could be any amount of things that could hinder your lymph system. When you're experiencing swelling, water retention, any kind of excess fluid buildup in the body, lymphatic drainage will help your body to absorb that fluid. So what we do is we are stimulating your already natural lymphatic system to just work better. Consider it like getting an oil change on your car. If you leave all that sludge in your car is not going to work properly. Getting that fresh oil, getting all that filtered out, and putting fresh oil is going to make your car run much better. So it's the same idea with your lymph system, where we're allowing fluid to be released from the body so you can feel much better. I'm going to go ahead and explain a little bit about what you can expect during your manual lymphatic drainage. Now, this is if you are not post-surgical, you're just coming in because maybe you have some issues with autoimmune disease, you might have Lyme disease, you heard somewhere that lymphatic drainage is a good way to detox. Whatever the reason you're coming in for, we will do a thorough consultation, figure out exactly why you're coming in to have a lymphatic drainage massage done. So I do a thorough intake, get your medical history, and just really get to know who you are and what your concerns are, and that way I can better serve you. Once we do the consultation, I begin your session. The manual lymphatic drainage sessions run anywhere between 50 minutes to 60 minutes, so about an hour, depending on if I need to spend extra time in certain areas. It is a head to toe session with the head, face, neck, and work my way down. It includes the belly area, the legs, the front and the back, as well as the feet, the arms, and the hands. So you're getting a full body. A manual lymphatic drainage massage is a gentle, rhythmic, pumping-like massage where we only stimulate the top layer of the skin, so there is no muscle involved. It's just the skin, moving that skin, and your fascia, which we'll discuss at another time. But your fascia is also involved. If anybody knows about fascia, or you can read up about it, that is also what we are moving around and stretching out just to help those lymph vessels open up and allow fluid to move through and get to your lymph nodes to be filtered out. And that's what's going to make you feel so much better, and you're going to notice a lot less swelling and water retention. You're going to have more energy. You're going to sleep much better. Other ways that you can enhance the effects of your manual lymphatic drainage is to drink plenty of water and to also go for light walks, nothing too strenuous, just to keep your body moving, because your lymph system actually works best with movement. All right, so this is for my post-surgical, post-op, plastic surgery recovery people, those who are getting surgery done, whether it's a BBL, liposuction, mommy makeover, tummy tuck, also facelift, chin lipo, anything like that, lymphatic drainage would be perfect for. However, you have to make sure that when you're looking for a therapist, you want to make sure that they are properly licensed, number one, in your state to perform manual lymphatic drainage. So they must be either a licensed, registered, or certified massage therapist, depending on what state you're in or country. And you want to make sure that they have a special certification, not only in manual lymphatic drainage, but also in post-op lymphatic drainage. So they're going to need both the basics of manual lymphatic drainage, because that's the foundation, and then they're also going to need a second certification in post-surgical lymphatic drainage specific. If they don't have both of those, you need to find someone else. Now, during any kind of plastic surgery, there's going to be some trauma to the body. So during liposuction, when the surgeons use their tools, they are going right underneath that layer of skin in between the skin and the muscle to remove the fat cells from that area. Your lymph vessels in those areas are being damaged. It's okay, they regrow, they come back, your body will heal. But what happens is now your lymphatic system has been damaged, so it's preventing your body from fully functioning. Now, you might already have a lymphatic system that wasn't working to its optimum before your surgery, and now you add the surgery, and that's going to add an extra layer of barrier to your recovery. So what we do as certified post-surgical lymphatic drainage massage therapists is we know how to move that fluid that's going to build up in those areas that your body's not able to process, and we know how to move that fluid to where it needs to go to be processed. Now, in my sessions, I typically will do the entire body, even during a post-surgical session, and I will spend more time working in the areas where you've had your procedures done to make sure that I'm getting rid of as much water retention, as much fluid out of that area, so that way your skin can start to heal. And this will also help prevent scar tissue formation, fibrosis, will also help your bruising, to be lifted a lot sooner, because we're getting rid of all of whatever in that area has been through some trauma. So anytime you're gonna come in to see me for your post-surgical massages, you're gonna get full head to toe lymphatic drainage, so that way we make sure that your whole lymphatic system is working properly. Because sometimes what can happen is if your therapist is only working in the areas where you had your procedures done, that fluid has nowhere else to go because they didn't make sure to open up the channels everywhere else. So that way when they start pushing that fluid and moving that fluid towards the lymph nodes have already been cleared out, everything has already been cleared out, and everything is going to come and filter out perfectly. All right, now I want to talk about what is the difference between post-surgical lymphatic drainage compared to incisional draining. Now, a lot of this has been coming up, especially in Miami and Atlanta. I'm not exactly sure where incisional draining originated from. Some say it came from Brazil and Colombia, and it came to the United States. I'm not sure. But as a licensed massage therapist in the state of Florida, it is illegal for us to use needles or hands, anything to push fluids out of incisions. It is illegal for a massage therapist in the state of Florida to do this. So a lot of massage therapists who are doing this practice are losing their licenses, and they're actually putting their clients at risk for developing infections and other things like that. So if you're having a problem with excess fluid and you feel that it needs to be drained externally, you need to contact your surgeon before you let anybody touch you. Let's talk more in depth about the differences between incisional draining and manual lymphatic drainage massage for post-surgical. They're kind of being mixed together to mean the same thing, and they don't. So what I perform is manual lymphatic drainage for post-surgical, where the goal is for your body to be able to absorb any excess fluid and be able to process it and then get rid of whatever's not needed through your urinary system. So this is all happening internally. We're moving fluid towards your lymph nodes, not towards your incision holes. So incisional draining is the opposite. Incisional draining is, their purpose is moving fluids, which include blood, out of the incision sites that have been possibly left open by the surgeon, which is normal. But once those incisions close up, which is usually 2 to 3 days post-op, they should stay shut. You do not need anybody reopening your incisions to drain fluid. That can be handled internally, and it's much safer and much better for you. All right, another misconception about post-surgical lymphatic drainage is that it's painful. You have no idea how many clients I have, or people, women, people that I've spoken to that are researching, surgery, and they're looking at getting surgery, and then they find out, oh, I have to get these drainage massages or lymphatic massages. Nobody even knows what it is, incision draining, and people are getting incisional draining, and that is very painful because they're forcing that fluid from underneath that skin to the incision sites. That's very tender. Your body's trying to heal itself. And so doing incisional draining, especially very rough and not to the level of comfort of the patient, is actually bringing more trauma to the body and making it harder for you to heal. And essentially, that's what ends up also ruining your results. So again, if you're looking to get lymphatic drainage after your surgery and someone is offering incisional draining, or that's what you're thinking you need, please talk to your surgeon before letting anybody drain through your incisions. Now I want to talk a little bit about how many sessions are you supposed to get? That answer is different for everybody. It depends on what procedure you've had done, how much you've had lipo, how much liters of fat did they remove, how many procedures you've had at one time. So if you had lipo 360, BBL, breast augmentation, chin lipo, like you had the whole deal, you're gonna need more sessions, because in that hour that you come in to see your therapist, they can't possibly work on all that and give you a good result in just 5 sessions. You know what I mean? So it definitely depends on the procedure, on the person, how well they're healing. A standard is 10, and you want to start them right away, especially when having lipo done, because those first few days is what's going to be imperative in your recovery. 10 is usually the standard. Most surgeons recommend at least 10, if not 15 to 20. Again, it depends on how you heal, the procedures you've had done, and also what type of results you're looking for. Some people are okay with having a little bit of scar tissue, a little bit of fibrosis. You might not be showing your stomach too much. You just want it to be flat. So as long as we get rid of that excess swelling and fluid retention, your incisions are nicely healed, you're feeling good, you can do 5 to 10. But if you're looking to continue to get the best results out of your surgery that you've spent so much money on already, you might want to do 15 to 20. So for me personally, what I like to do in my practice is I offer a 5 or 10 package, depending on, also people's budget. Sometimes you can't afford to do the whole 10 right away. I do offer a little bit of a discount on the 5 and the 10. You get more of a discount on the 10 than you do the 5. But that way you choose which one just to get you started. And then once you're done with that round, then at that point, I'll reassess, look you over, and decide what week to do next. All right, so I think we've covered pretty much all the different aspects of lymphatic drainage, whether it be basic manual lymphatic drainage session and also your post-surgical. If you have any further questions after watching this video, something that I might have missed that I didn't touch upon, I have no notes. I'm literally just talking off the top of my head, so I'm trying to remember everything and give you guys good information. But if there's anything that I missed or anything that you just need more clarification on and you want more information, please reach out to me. You can DM me, you can text me, you can call me, you can email me. I'm gonna try and have a contact form on my website. Any way that you can get in touch with me, go ahead and do it. If you have any questions, please don't hesitate. I am open to helping you and working with you and just being a resource for you, especially during your recovery from plastic surgery. So I do have some packages available. I'm gonna do a little special probably for anybody who's watching. I'm gonna do a special on my packages. So if you have a surgery coming up and you need your lymphatic massages, I'll give you a good deal. I wanna thank all of you who registered for this event. This is my first time doing something like this again. I'm sorry I couldn't be live because I had some stuff come up, but I wanted to make sure that whatever information we were gonna discuss in the live, I was gonna still give to you when I said I was going to. So thanks again for joining me, and you can leave your comments in the comments section. I'm gonna be coming back to this video periodically over the next few weeks to check in and see who's commenting. If you have any questions, if you don't want to comment on here because you don't want anybody seeing, you can send me a DM, private message, and I will get back to you. So thank you for watching all the way to the end, because if you're listening to this, you've made it to the end. I'm trying not to make this too long, but it's a lot of information and it's still not enough, to hear all this information is a lot. So make sure you're following me on all my social media, TikTok, Facebook, and Instagram. Those are the three that I'm usually on. I'm usually on Instagram most, with Facebook coming in second, and then TikTok when I have a chance. I try to upload there, but definitely make sure you're following me on all my social media. That way you can get more information as it comes. All right, so I hope you all have a wonderful night. Get some good rest, and I am going to be doing these more often. I'm gonna try to do something once a month. Even if I can't make it live, I'm still gonna probably be putting out videos like this that really like get into what manual lymphatic drainage is and what post-surgical, specifically lymphatic drainage, is. My goal is just to educate as much as possible, because I feel once people are educated on this, it's like a no-brainer that this is something that you need to do. So again, if you are having a surgery coming up in the next few months, please reach out to me as soon as possible. Even if you're not going to get a package right away, or you're not sure if you can afford it, please reach out to me, because my schedule fills up quickly. And I want to make sure that if you are buying a package and you're having a surgery coming up, that I have the availability to put you on my schedule, so that way, I can help you out. So if you want more information on packages, on my pricing, and also on the special that I'm going to be giving just to the people like you who are here watching this information, nobody else is going to get it, please reach out to me and I will give you all the information. Have a good night. Bye.